The ongoing challenges at Rhode Island hospitals now reaching a tipping point as emergency doctors are being forced to decide who can be admitted into the ICUs.
It's being described as a perfect storm for hospitals, staffing shortages and record high positive COVID cases. The National Guard is now stepping in to help neighboring states, but what about Rhode Island?
12 News reporter Anita Buffoni spoke to a top ER doctor about this. She joins us now live in studio with what he had to say.
Well, Kim and Brian, Massachusetts and Connecticut have activated their National Guard to help with the staffing crisis at hospitals. But as of today, Governor Dan McKee's office says those talks are happening, but a decision has not been made. ER doctors tell me they will take any help they can get. An unprecedented crisis. That's how some doctors describe the current state of Rhode Island's hospitals. Rhode Island isn't alone. This is the Massachusetts National Guard training earlier this week to help Bay State hospitals. But Rhode Island's National Guard has not yet been activated.
I'm not exactly sure why that hasn't been done up until now, but any help would be more than welcome.
Rising ICU admissions and a lack of critical care nurses are forcing doctors to make hard decisions. How is the hospital dealing with such small number of staff with rising numbers of patients?
It's a great challenge. I feel like we're in a dire situation where every night making decisions about who should or shouldn't come into the intensive care unit.
Recent data shows the 7-day average of COVID hospitalizations in Rhode Island is down from last year. December 27th, 2020, there was an average of 455 patients in the hospital. The same time this year, 303 patients. The director of critical care at Lifespan explains why it's more difficult this time around.
The nursing staff, the crisis has led us to have to close multiple critical care beds. So we have smaller numbers with COVID, but fewer ICU beds.
Now, Lifespan says the staffing shortage is caused in part due to the nurses leaving because of COVID burnout. The vaccine mandate making up just 1% of the loss in staff at Lifespan. A new class of nurses is set to graduate soon to take the ranks and hopefully help alleviate the shortage. I'm Anita Buffoni, 12 News.
And staffing shortages coupled with a rise in hospitalizations are crippling local hospitals. The National Guard is stepping in to help Massachusetts and Connecticut, but have not been activated in Rhode Island. 12 News reporter Anita Buffoni spoke to an ER doctor about the challenges they're facing. She joins us now from the control room with those details. Anita?
Well, Shannon, no decision has been made as far as the National Guard in Rhode Island being activated. The governor's office tells me, though, that those talks are happening. One ER doctor told me earlier today he's not sure why that call hasn't been made. For weeks, emergency doctors have been ringing the alarm. Hospitals are filling up and fast. With the staffing shortage and an increase in ICU patients, the director of critical care at Lifespan calls it a perfect storm.
I think any help that we can get to increase our capability of admitting both wards and critically ill patients would be enormously helpful.
That help may come in the form of National Guard members, but the decision hasn't been made by the governor to activate it like Connecticut and Massachusetts have.
I wish it was possible to just bring all of the ward nurses into the intensive care unit, but that's not possible given the specific skill set required for critical care nursing.
Multiple critical care units have been forced to close because of the lack of nurses. Lifespan is operating one. Recent data shows the 7-day average of COVID hospitalizations in Rhode Island is down from last year. 455 patients this time last year compared to 303 patients this year. Dr. Levy says 90% of the patients in the ICU are unvaccinated.
This is a COVID crisis of the unvaccinated.
Now, the governor has not had any public events in recent days, but I'm told a short time ago that the governor will be holding a 2 p.m. COVID briefing tomorrow. You can count on 12 News for that coverage. In the control room, I'm Anita Buffoni, 12 News.